the Stronger After Stroke podcast. I'm your host, Rosa Hart, the stroke nurse navigator at Norton Healthcare in Louisville, Kentucky. Today, I have a very special guest who is a stroke survivor, and she would like to share her story so we can see if it would be encouraging for others. This is Bella. Bella, can you tell us a little bit about yourself?
Absolutely. I am basically from Louisville. I moved here when I was about 2 years old. I've kind of just stayed in everything. I went to school for journalism, then fell into marketing, and then my husband and I have started to run different companies together. So I'm just kind of busy everywhere all the time.
Yeah.
Yeah.
And you and I had met before all this stroke conversation.
hmm
And so I was really glad that we had that connection here locally. So it's really great when you can help your neighbors.
Absolutely.
So,
And I haven't talked about it much. So it's, I think I maybe posted about how I'm happy that I survived through it, but maybe not anything else.
exactly.
Yeah, perhaps nothing.
Now,
Actually, nothing.
So before you had a stroke, you were taking care of your mom, right?
Absolutely, yes. So my mom had a brain tumor in 2006, and that left her with meningitis, and she fell into a coma. And she was a nurse actually at Norton. And so after that, she, woke up and was brain injured and couldn't be a nurse or do anything really independently anymore. So I've been taking care of my mom since about 2008 on, but more hands-on since 2016.
Yeah.
hmm
And so with that experience, you probably are a lot more familiar either from her educating you as a child
Yes,
or through taking care of her.
absolutely.
You probably understand a lot about how the body works and how the brain works, especially because
Yes.
she had a brain injury.
Yeah,
So,
she had a brain injury that then sadly led to seizures and strokes. So, I mean, I'd seen it. I just, you don't really, it's hard to understand unless you're putting that into play about yourself. You know what I mean? Like,
exactly.
it's one thing to watch it, but it's a totally different thing to go through. But it did give me some reference points while it was happening and there right immediately after. So,
Yeah. And I think a lot of people will expect stroke symptoms from someone who is older or like retirement age, for example, but maybe not someone your age and my age.
oh, yeah,
So, would you say that your experience with your mom was helpful at all when you started showing stroke signs and symptoms? Or,
absolutely.
okay, so
Yes. So,
can you
whenever I
tell us
was,
about when that happened?
absolutely. So I was 29 or 39, excuse me. I wish I was 29. 39. I know. Oh, thank you. So I was 39 years old. My husband and I went out of town to Italy, just having vacation. And I was really excited to be there, obviously, because it's just on the other side of the world. So it's
And it's a
the fourth
beautiful
day,
place.
and it
Yeah.
was. So, the night before we left town, I didn't get any sleep. I just had basically stayed up all night, made sure everything was good for kids, dogs, cat, everything, and myself. And is the house clean? Because I don't want to leave it whenever it's dirty to come back to it that way.
I feel
So,
that way too.
I was just up all night. I got onto the plane and I fell asleep, and I didn't wake up until we landed, which means I didn't move or do anything else. So I had some right leg swelling right away after we got there, and I had a few like weird nosebleeds that I've never had before.
Hmm.
I'm not sure if that's related, but everybody is like, it could be. Um, so, the night before was very normal. My husband and I went out to eat. We went back and we're just enjoying the views. We were in Lake Como, and so that's a very I'll talk about the logistics on getting there right after this. So that night, we went to bed normal. And in the middle of the night, I remember waking up and I had tunnel vision. Like my hands, I looked at my hands on the bed and like it just looked like they were so very far away from me. It was so pulled back. And my husband said that I didn't realize it, but that I was like gagging. And he was like, "Are you okay?" And I was like, I remember saying, "I just can't get the words out."
Hmm.
And so after I said that, then he just thought it was, I was just sleeping or, you know what I mean? Like talking or in my sleep or
Yeah.
he had no idea. I went to bed. I woke up. I think that was around 3 o'clock in the morning. I woke up and my husband had to help me get to just the side table so that we could have breakfast. And right as soon as I got up, it felt like my equilibrium was off because I was just swaying back and forth. And right when I sat down, he asked me, he was like, "Are you having a stroke?" And I was like, "Please don't say that. You know, that's happened with my mom. I don't want to manifest and put that into the world so it happens." And, I told him, I was like, "I just don't feel good. I'm just going to lay back down." He let me lay back down. He went on a walk, and then like 40 minutes later, like 30 minutes, because it took him about 10 minutes to get back. But he was saying that um, he just knew something was wrong. He had a like gut feeling. So as soon as he got back, he woke me up. I couldn't move my right side nor speak, but I could hear and everything. I mean, I could move my left hand, but it wasn't enough where I could write things that would make sense.
And do you remember that? Do you have a clear memory
I
of him
remember all
waking
of
you
it.
up and how that felt?
Yes. I mean, it was wild. I mean, it's absolutely terrifying to be stuck inside of your body. And as he was saying things to me, like the words that I wanted to say, it was almost like an index card in my mind. And you would see like the letters go across of things I was trying to say. You know what I mean? So it was like such a vivid memory of that. Then, I mean, I was freaking out the more he started freaking out. And then he called the hotel people. Two of them came up and they freaked out. And so, you know what I mean? It was just a back and forth of like every time everybody was responding, it was just like made it worse for myself. Um, my husband had called an ambulance. It took them 45 minutes to get there due to how the roads are. And they're all very small roads around everywhere. I feel like except for outside of Maine, like Italy parts.
Mm.
So it took them 45 minutes, then 45 minutes to get me to the hospital. And when they brought me in, I remember the ambulance ride and everything. My husband was with us. They were trying to talk to me. I just couldn't say anything, but I could hear, and everyone was trying to calm me down, obviously. And so I tried to just like breathe and not freak out. They were like, "We're almost at the hospital," in the best that they could say these words to me.
Mm-hmm.
It's broken English a lot. But once I went into the hospital, as they do in emergency situations, they cut your clothing off.
Mm-hmm.
I remember being on a table with no clothing, and everyone just was like staring at me. And I was like, this is horrendous. And finally, someone got a blanket to cover me up. But they didn't know what was happening. They didn't know it was a stroke. The hospital was so very small.
Oh, no.
And to give reference, it would be an example of walking. So it looked very much like Wagner High School. If you're familiar with the outside of that, right in St. Matthews, I mean, I drive by it all the time. It reminds me of it vividly.
Oh, no.
So it was very,
Yeah.
it was an older place with a very old interior and not wonderful. I'll just say that. So they made my husband say his goodbyes to me because they didn't know if they could save me. They didn't know what was happening. So I don't know how they got to that conclusion that I was having a stroke, but I'm very grateful that someone finally figured that out. I think they had to have someone come in for that. He spoke English as well, and that was very helpful. I remember the surgery. They started through right here to go up and get it. So I had a basal artery stroke.
Basilar artery.
Thank you. Yes. And they said the only thing that kept me alive is that I have large veins and blood was still flowing.
Wow.
Otherwise, I would have not been here to talk about it.
Wow.
Yeah.
So they did do a neurosurgical intervention and through your groin to remove the clot, and it was successful.
It was successful, and as soon as they removed it, I could walk and talk and do everything, and so I was ready to go.
I bet you were.
I mean? Like I was like, I need to get out of here. I need to get back to America. I need to go, and like they wouldn't give me the medical clearance to leave, so I couldn't get medical back. I couldn't get anything. And I agreed that I would stay for 3 nights because we were leaving on Monday, and I was like, I'm not staying here past then. So I also have Crohn's, and they were then, as they give stroke patients, giving me blood thinners. So it was making different situations starting to happen. And anytime I tried to explain it, I had my phone and I was doing Google Translate, and I handed it to them so they could have done it back, but they chose not to.
And they didn't have an interpreter for you?
No, not well. I mean, they would maybe say like, no, I shouldn't do something, or
But they didn't
so.
use an interpreter service or anything like
None,
that?
nothing at all.
Wow.
So, I mean, my dad's father was Italian, so I can understand it slightly,
Mhm.
but it's just here and there. So, but I started to Google record what they were saying so I could read it, just so
And
it would
translate
be.
it that way?
Yes, yeah. Otherwise, I wouldn't know. But they weren't explaining what they were giving me in my IV, so I pulled every single one out. But it was blood thinners and things like that. And I was explaining to them that I have Crohn's and you can't add that in. And it was just a very complicated situation. They don't let people get up and walk.
Oh.
So everything is completely opposite. They put a bed alarm on me. They said I couldn't get up. It was just a very difficult situation. They wanted me to be on a catheter and not using the restroom. And I'm like, this is all wrong. You know what I mean? Just from seeing my mom go through things, it's like, that you have to immediately get them up and get walking and like just functioning. But they don't do that there. And I was in a 4-room ICU that was shared. So it was, there was a woman next to me that was German and couldn't speak, and she cried the whole time. And I was like, I just have to get out of here. You know
Yeah.
what I mean? Because I know that she was going through things and so was I, but it was just it was just a whole lot of emotion happening all at one place. And then having people not understanding
Mhm.
what I'm saying or why.
Right.
And so, Sunday had strolled along. They said that they weren't going to discharge me. And sadly, I'd already Googled everything. And I was like, well, as it's a right as an American that I can leave whenever I want, and you can't keep me here. And so they wanted to run every single test that they could, so just to check and see why I had it, so that they could see if I would have it or give an estimation to my husband for it. And it was during COVID, so they would only let him come see me for about an hour a day
Wow.
instead of allowing me to have someone there with me, even if he had the vaccine and was masked, which is very difficult. It felt like, oh, I'm going to cry. It felt so very lonely
Yeah.
and hard to advocate for yourself. But I knew, because of history with my mom and things like that. Sorry, I'm like getting choked up.
No, this is your story, and
Yeah, I mean,
I appreciate you sharing it with us.
no, it was just wildly difficult. But they finally, they scanned my legs to see how my veins were, circulation was going. And
Mhm.
I feel like they did every single scan that they totally could. And the very last thing, they couldn't find it or any reason why.
Mhm.
And so the very last thing they did was a bubbles test,
Mhm.
which confirmed I had a hole in my heart.
Mhm.
So that was what that was.
Yeah.
And so whenever I got home, I came home the next day. They just, they said, if you're going to leave, then compression tights. So I went to their pharmacy, got that. I forget what else they gave me, but I think it was basically prednisone, which is good. And especially with autoimmune issues, you kind of get used to having to take it. But it's really bad for me personally, for my mental health.
Mm.
So it was bad every way around it. But I wanted to get home. So I was like, I'm going to do what they're saying
Yeah.
to get home. And luckily, I have a very good friend that's a doctor that was able to get me in with a lot of people very fast. And my doctor also was able to get me into
Your primary care?
my primary care. Yes, Dr. Sal Ciliberti. He's wonderful and just was very helpful immediately. I think everybody thought I was brazen for coming home so fast, but I just couldn't take the fact of my husband was going to leave. And I was like, there's no way I'm going to
Yeah.
be in Italy all by myself.
Right.
So it was,
Especially with the language barrier, even if they could give you good care, it's really hard for you to know with
yeah.
that language barrier.
Well,
So,
the language like that, and equally that, I mean, they were treating me. So they said I was an aggressioso Americano, which is an aggressive American. And I'm like, I guess it's from pulling the IVs or wanting to get up. And I mean, it was just wild that I wanted to get up and walk because I knew I needed to. And so it was just
yeah.
it was just a complete backwards experience as to what we do in America.
Well, and different hospitals have different practices. So I'm really glad you're bringing that up because it is good for more people to be aware that best practice is to encourage mobility as much as possible, unless
Absolutely.
there's some specific reason not to, in which case you can discuss this is the specific reason not to, because laying around is not actually going to help you get better by itself. A lot of the times you would think, oh, they're resting to recover, but you do need to move to recover in general.
Absolutely.
So people may get confused on the mixed messages. So I'm really glad you brought that up.
Yeah.
Once you got back here, what did you think about sharing your experience with other people? I know you described feeling lonely in a hospital full of people who are talking to you about it, but when you got home, if you didn't feel ready to share it with friends or more people, how did that feel? What were your thoughts about that?
So when after the Italian doctors told my husband to say his goodbyes, which is a very haunting thing, and to hear it and you can't respond with what you would say is so very difficult. But my husband had already made a lot of calls. He had called my dad and my brother, with my mom's fragility. He didn't tell her, which I'm so grateful for, because I was able to come in right away, and I put a mask on and everything, and I just went in and I told her because I wanted her to see and feel that I'm okay. But no, my husband had told a couple of really close friends, so it was a pretty supportive situation in that way. But it's not like I was afraid to share. It was just such a difficult and different time. I have back issues. I've had back surgery. And so, I think that what complicated everything after is that I was prescribed Flexerol,
Yeah,
for,
Flexeril, yeah.
thank you, for the evening. And then during the day, it's like, uh, I'm going to mess it up. It's another muscle relaxer, and those two combined, and then also with baclofen that had been added in, they said that, well, I'd already stopped the other daytime muscle relaxer, but baclofen and Flexeril mixed together add in confusion, fatigue, everything, like difficulty to remember things. It's just, and it was only caught a year later by a pharmacist when I was getting it filled, and he was coming from another pharmacy, and he looked at it and he was like, you shouldn't mix these together. And I was like, out of every doctor, and no shame against my doctors, they're all great. I'm sure it was just an oversight, but it was just frustrating to think that all that time I thought it was me, and I thought I had all these problems because of the stroke, which some things are still there that, we can get to, but I had wild difficulties, and that's where I was afraid to meet up with people, because I didn't want people to judge that I'm more all over the place than my normal ADHD person self is. You know what I mean? It was just elevated, and I was just ashamed of seeing people at that time.
Yeah. Well, and you never know how someone is going to react. And so I really appreciate you being willing to share your story now, because I think it's so important for other people who have experienced it, for example, or maybe experienced aphasia and then maybe have not been able to regain it like you have, to hear that your experience, and maybe even to let their family know they're still in there. They are still having thoughts and have things they want to communicate, and maybe that needs to be done in a different way. And so in a way, it's people like you who are able to recover and say, no, I was still thinking clearly, and I knew what words I wanted to say. I think a lot of the time when people can't speak clearly after a stroke, it's really easy for others to dismiss them as not having a thought worth finding out is in there.
Absolutely.
And so with you and other survivors that have come in, that's something I really want to emphasize.
Yes.
So that those family members can be encouraged that their loved one is still in there. And then we've also talked about resources that can help with that, from virtual aphasia support groups.
Yes.
to music therapy where people can learn to talk again
My mom
using
did that.
song. Oh, you
Yeah.
did? And that
Mhm.
helped her?
That helped her a lot,
What
yeah.
was that like?
It was wonderful. I mean, and I know it was hard for her to talk, and now having that experience myself, it goes a long way. I mean, but yeah, no, it's not I said again, it's one thing to watch, but then it's a totally different thing to experience. And
Mhm.
I do feel like I wasn't I'll never say I'm blessed. You know what I mean? It's not that kind of a situation, but I'm very grateful that I have been able to come back as fast as I did, sans not knowing about a full year of taking medication. But as soon as that stopped, one of my girlfriends told me that she was like, "That's the first time I thought that like you are fully yourself," and I didn't even tell her what had happened, and so then I
She felt
explained.
something was different, but couldn't put her finger on it.
Hmm.
Yeah. And so, what would you say now that you are cleared up from medications causing you to
Hmm.
experience more differences at this point? Where would you do you have any residual stroke symptoms that you are still dealing with? Because you look like no one would ever know.
Thank you. I appreciate that. It's a facade. No.
Well, a lot of
Yeah.
people can't do that,
Yeah.
right? And
No.
so, what is left over from that that you feel and notice in yourself?
Writing is still a little bit difficult for me, and I was a writer for a long time, and so that's been difficult. And I feel like writing is much more significant when you're using your hands to write it rather than to type. I feel like you get a different experience out of yourself because it's a little bit more of an intentional mind connection.
Mm.
Um,
And is it more the motor operation of the writing? It's not
yeah.
so much that you have trouble getting the words out on paper, for
No,
example,
yeah.
or
No,
anything
it's
like
more
that.
motor skills
Okay.
have just been adjusted. And that has also kind of impeded upon some of my other tasks where I have to edit video or I have to do different presentations based upon just anything with marketing that I manage. So, those are the small things. And at times, my memory is very bad. It wasn't before. I feel like I was a much more like detail oriented person,
Mm.
and you might even see me struggling to find certain words now.
Mm.
I feel like that's very much what my residuals are.
Mm.
I think probably my husband and only my close friends can figure that out. And sometimes, I was flying with one of my girlfriends, and I asked her, like, I'd asked her 3 or 4 times, but it felt excessive what gate we were at, and it was all pretty close
Mm.
within time. And so it's just the key details of moments or anything that I'm trying to remember, say, or just generalized vocabulary that I used to have. Yeah, I search and struggle to find the word now.
Mm. Where it would have just been a smoother process
Yeah,
before. Yeah.
yeah.
So, what would be something that you wish everybody understood about having a stroke?
I think that it changes you. I think it changes you forever. I think that having a stroke adds in a new level of your appreciation for life. Um, you mildly feel kind of like a silent outcast because I do look normal. It isn't something where people will give me that daily grace upon if they don't know me. They might just think I'm kooky or something like that. But, it's just, I feel like there's just it's like a hidden illness or a silent illness that nobody really notices until I tell them my story. And then they're like, oh, you're so young. How'd you have a stroke?
Hmm.
And I think that strokes, they impact everyone, ages, races, everything. I don't really think that it comes from, a lot of people argue about where they start or what happened, or was it just with COVID and things like that. And it's like, at the end of the day, I think it's just more about, because that's one thing people have asked me. They're like, oh, do you think it's because you had COVID or because you had the COVID shot? Or, and it's like, I'm like, I don't think so, because I had a hole in my heart that had to be repaired. And luckily I was able to fix that. So I don't, knock on wood, expect any other strokes in my future.
Right.
But also the stroke, just the MRIs from that led me to having they told me about the small brain tumor that I have.
Mm.
And so, I mean, that's it's wild that those small things never pop up, but nobody needed to do an MRI on
Right.
my brain until then.
That's
So,
not something that was giving you symptoms that you would go looking for it.
no,
Yeah.
I mean, I asked if that was related at all, and they said no.
Yeah.
So, yeah.
And like you said, there can be so many different causes of stroke. Over 800,000 people a year experience a stroke in the United States
Hmm.
alone. And stroke is the number one leading cause of disability worldwide. So it does affect pretty much everyone because even if you're not the one to experience it, you probably know someone who's had a stroke, and it really does affect the whole family when it
Yes, very
happens,
much.
either when you're taking care of your mom or just your husband and your kids and all that. Sometimes there's a change in income, and that definitely has a huge ripple effect.
Takes away from
So
your self value a little bit. I mean, I thrive on work. If I mean, you know me, and so
yes.
anyone that knows me knows that I love work. I mean, maybe I'm a workaholic, but I didn't feel um, capable of working for 3 months, and my husband's a harder worker than even I am, and immediately was like, "You have to get back to work." He's like, "You have to, just for your mind, you have to get back in." And I mean, I struggled with so much. Luckily, people that I worked with knew, so they gave me some grace on that. But
And
I
allowed you to kind of gradually work your way back up.
absolutely, yeah. But as soon as I then figured out the medication
Yeah.
complication, I was like, wow, light bulb. I mean, all of a sudden I was back on a lot of things. But I feel like the process of understanding certain things changed after I had a stroke. So, just for an example, during that first 3 months, I made a blueberry cobbler, and I just started cooking at home more because watching like videos on it, and then reading the ingredients and making sure I'm getting it correct was just, I felt like a very good building way for me to kind of help piece things together,
Hmm.
um,
Yeah.
which sounds unique or weird, but I mean, it
No,
was just
it's
more of
great.
um, I don't know if it was just helping my brain be task oriented or just the process, but it helped everything a lot
And then you could feel
uniquely.
productive. You had
Yeah,
accomplished something, and you got to enjoy the fruits of your labor. That sounds like a
absolutely.
delicious way to rehab yourself.
I know. Yeah, it does actually.
Baking at
Yeah.
home. Yeah. So, Bella, I know you said you had kind of your mind wasn't as clear as it could have been the first year. Are there any resources that you found were helpful in stroke recovery for you or for your mom, that you would recommend to other people, either books or anything online that was helpful for you?
I think that I went through a lot of the activities that my mom had just in her room and still had in her room that she was using. And so even doing that with her, I mean, it helped her, but it also started to help me.
Oh, good.
And I was able to spend obviously a lot more time with her during 3 months. But, I think it was pretty difficult for anybody to see me struggle and relearn, especially with her. But no, I mean, I think that it was mostly, I wish I would have done other things. I had purchased this machine, but it's also available at different places in Louisville.
Hmm.
It's called Brain Snap, or I might have to correct myself on that. Um, but it basically, you just put it on, it covers your eyes, and it just brain tap. There we go. It's
Brain
called
tap.
Brain Tap.
And what does it do?
It just helps your brain process and heal through sounds and
Oh,
lights. That even with your eyes closed, you're just supposed to allow it to. It's just basically meant to help your brain start to function again, or more deeply. So I still have it, and I still try to use it as much as I can. I believe in red light therapy as well.
hmm.
And so, I mean, that's a pretty healing thing for your body. It gets rid of inflammation, and it just does all of the magical things. And so I had
Things that you
access.
need if you're not getting enough sunlight, for example.
Yes.
Yeah.
Yeah. So, but no, I started using a red light for that. Truly, just anything. I used supplements. I went down a huge supplement like tunnel. You know what I mean? Because they're like, there's a million brain things that you can do to help you function, but then it might also then impact other things that you're
Exactly.
taking. So it's kind of, doing that, but with my doctor knowing,
Yes.
about all of it.
Making sure it doesn't interact with medications you're
Yeah,
on, or
because otherwise you have to
you can
Google
get
it
too
all.
much of certain things and your body might metabolize something different than
Yes,
someone else might. And so
absolutely.
definitely having a open line of communication with your primary care provider and any other
Hmm.
specialist you're working with, make sure
My
everybody's on the same page.
hematologist was wonderful throughout that
Oh,
phase.
good.
So yeah, no, it was great. And sadly, had access to all of these doctors a little bit before, just either due to my mom, myself, or just dealing with Crohn's in general. So, but yeah, no, I wish I did more things or more activities, but I mean, bought a lot of different things, and some things worked for me, and some things did not. But mostly I just try to give myself a lot of grace, and I feel like I've learned things organically, maybe,
Mhm.
and it's taken time. I've not snapped back. I mean, am I my normal self even now? I don't think so. It's complicated. I don't think that anyone ever truly recovers.
You mean emotionally or mentally?
Both.
Yeah.
Emotionally, it's wildly traumatic. I mean, I can't um, tell you how much closer it's made my husband and I, because Um, it's a horrible thing. I mean, he watched me almost die, he thought, so, and possibly even there it could have happened.
Yeah. Mhm.
It was a very small hospital that didn't have great resources. So, probability was against me. And I think to watch myself come back from that has been hard for him, but also just really connecting for both of us. But it's taken a lot of time to kind of process everything. And then sometimes I'll even forget that I'm having a challenge in finding a word. But, I just have to remind people, just to give me a little bit of grace. And I think just asking people for what you need is difficult for anyone.
Right.
But either I hate it for stroke survivors that can't ask for it, but hopefully their families might give them a little bit of grace. Maybe from watching this, I might sound like a mess when I say, a lot of things just because the words aren't always coming out correctly, but
Well, I feel like I'm understanding you pretty clearly. So
okay, good.
you're doing great. And
Yeah. It's
the
just a
thing,
self-conscious thing, I think, as well.
yeah,
Yeah.
exactly. And so for anybody who is practicing getting their words out, and maybe people don't know to give them extra time to get their words out, that's when those aphasia support groups can be really helpful
Mm.
because
Mhm.
everybody there knows the struggle and is prepared to let you finish your own sentence, even if it takes a long time.
Mhm.
And so I'm really glad you had a support system
Yeah.
to help you in your recovery as well.
The biggest
Yeah.
thing about that too, because I even remember you inviting me to it, and it's so bizarre to say that I was so embarrassed too. And it's just like, I don't know if it's like a pride thing or, like I said, it's a facade. You know what I mean? I usually just try to present myself in a way where I look like everything's okay, even if things are not okay. But I think that it would have helped me tremendously if I would have joined your group, perhaps even still.
And there are virtual ones online that anybody all over the country can join in. So you don't have to necessarily go in person.
Mhm.
So those are great options too.
That's good to know.
Can I ask you about that embarrassment you felt? Do you feel like because it's not visibly apparent that you had a stroke, that you wouldn't fit in? Or was it that you didn't want other people just to see you being vulnerable in general? Or what do you think
I
what
think a little
was
bit
more
of
of
both, but it was mostly embarrassment, just even for myself to not
in front of yourself?
mhm, to not have that ability to have a conversation, especially during all of that time, fluidly,
Right.
or to pause a lot more frequent than I even am now, in between words. I think it's just an all around. I wasn't who I used to be, and I couldn't accept that as fast as I should have. Or, I think it's all a process. And I wouldn't say that I'm normal now. But, I think that it's with distance and time, you heal a lot. It's just kind of getting back out there. And I mean, I've gone to work, I've done other things to just kind of push myself back out into the world, and that's helped tremendously. I mean, the temptation to isolate is very high. I still have it at times now, just where I feel like I can't be that vulnerable with other people to let them know how I am struggling. And I'm sure I've lost a lot of friends through the last couple of years, or, people might not feel as close to me. And it's, it is a pride thing to be like, oh, well, this is just, it's me thing. And even if I say that, I think people maybe don't think that from seeing me in person,
Right.
So it's hard. I don't know. I don't blame people for not understanding because they don't know any better. But, I wish people did, but I think that's pretty common.
Right. And so we know now that loneliness is one of our social determinants of health. And people who are able to engage with others and feel connected are probably going to have better outcomes than people who are experiencing loneliness. So on the one hand, there's that push to isolate, but then on the other hand, we really need that connectedness. But you're a very outgoing person, like I am at
Thank you.
baseline. And
Yeah.
so I think you and I might have more expectations of ourselves to be in maybe larger groups or seeing people more frequently.
Mhm.
And I love that. And I know you do too. But yeah, it can be hard to pull back and give yourself space if you need to rest, for example, right?
It's
Did
just
you?
overwhelming as
Yeah,
well,
and just to mentally recover from the activity you were doing, do
Mhm.
you feel like some of that need for isolation is also fatigue and that you need some rest and
Absolutely.
recuperation?
Yes, absolutely. I mean, I I'm still mildly a night owl. I mean, I'll stay up until about 11:30, and that's like naughty for me. Um, but
You
yeah,
might see Santa if you're
yeah, I
being naughty
know.
like that.
I know. I'm not going to get anything for Christmas. But no, I have learned to rest a lot more, and my husband says that to me a lot. He's like, "You need to rest," and so it's just, I think he recognizes where I'm starting to struggle at the end of the day, and he's like, "Okay, you just gotta stop." Even if it's like working or if I'm writing an email, sometimes it's stressful to make myself concentrate so deeply on what I need to say in the right amount of verbiage instead of taking a huge long paragraph and just making it a couple seconds or sentences, I should say. So, yeah, that's just hard. But I don't know if it's like acceptance that I've learned to like just be okay with it. At first, it's just really hard, and you give yourself such a difficult time about, why can't you snap back? Why isn't this happening faster? And it's a process, and it's horrible, but it's
Well,
something.
you're a human, not a boomerang. So,
Thank you. Yeah.
and you're on a different journey now than you were before the stroke. And so you hold yourself to a different new standard based
Mhm.
on what's best for you now.
Yes.
And so I'm really glad you're learning that self-acceptance, that's the hardest thing for us to do.
Mhm.
We can never please other people. So we better learn to accept ourselves, right?
Yeah, people pleaser. Like, you know what I mean? And that's the hardest thing is because then you have to let that go
hmm
just so you can survive and make yourself feel okay.
Yeah, exactly. Thank you for making yourself a priority, but also for being willing to share your experience in case
Absolutely.
it can help others as well, Bella. I
Yeah,
really
thank you for
appreciate
asking me. I'm really happy that you did. I know I've been wanting to do this a bit, and I probably even pulled back a little bit just out of shame or
it.
embarrassment.
Aw.
So I'm happy that I'm here. I don't know if it's ever gonna make me like not embarrassed that, to not be my old self. But I mean, I'm trying to remember that evolving is part of human experience. So
That's right. You don't want to be stagnant for
no,
sure,
yeah,
right? Yeah.
yeah.
So,
Thank you so much.
yeah. Thank you, Bella. I appreciate you
I
coming.
appreciate you too.
So, if you've enjoyed this episode of the Stronger After Stroke podcast, definitely subscribe and like it on whatever platform you're on so we'll know. Leave any comments in the comment section about what you learned or what you would like to learn more about. I'll try to include in the show notes some information to join the virtual aphasia support groups and some of the other things that we talked about in case you're curious about it. And then feel free to reach out to the Norton Neuroscience Institute Resource Center if you have any other questions about how to be stronger after stroke. And I'll see you in the next episode.